in my personal opinion, it's very important to understand the biology to be able to utilize the graft material in your clinic. So we're going to talk a little bit about the indications of bone graft, the properties of bone graft, different bone graft types. As I said, the autograft is going to be covered by Dr. Ahmed. I'm going to just mention it briefly, and I'm going to focus on the 3 other types. I'm going to talk about some of the new innovations and new technologies that are being used in bone grafting. And then we'll switch to barriers and the types of barriers and when to use what material and what barrier. So in general, the indications for bone grafts, first is periodontal defects. Whenever we have an infrabony defect, we can use bone graft material to fill that defect. We can use it also in combination with barrier membranes in GTR or tissue regeneration, guided tissue regeneration. We can also use it in socket preservation, and there was a question earlier about socket preservation. Socket preservation is when we extract a tooth and we fill that socket with bone graft material in hopes to preserve that socket. Ridge augmentation. Before we place an implant, if we have a deficient ridge, we can use bone graft materials in combination with barrier membranes to augment that ridge for it to be ready to receive an implant. And implant site preparation, meaning at the same time of implant placement when we have limited defects. Sometimes if we have enough bone for primary stability, we can graft and place the implant at the same time. These days, you're going to hear a term that is very important. It explains what is the best way to treat your patient. The prosthetic-driven dental implant, and that's what Dr. Muhammad and Dr. Tariq was talking about. The prosthesis will guide us on where to place the implants. So you have to be able to visualize, and you have to know what kind of restoration is going on your implant before you place the implant, because that will determine the position and the position and the angulation of the implant. So you need bone and tissue must be an ideal volume for you to be able to place the implant in the right position. When we have multiple teeth to be restored, we can use techniques to augment both bone and soft tissue to get the most aesthetic look.